Hello and welcome to the Johnson & Johnson Institute Education Modules for Healthcare Professionals. This programme intends to reinforce the skills considered essential for providing optimal healthcare for both mothers and infants during the first 1,000 days of life. Today we will begin with Module 1 by reviewing the practices of infant bathing. We will describe the implications of the first bath in newborns, its role in their transition to the extrauterine life as
The information provided in. Before we begin, we'll go over the player control.
For this module, it is essential for the learner to be able to describe the Historically, the first bath has been given immediately postpartum, mainly due to cultural preferences and healthcare workers' protection from contaminated bodily fluids. Its primary goal is indeed the removal of unwanted soil, such as maternal blood and pathogens as well as meconium. However, the vernix caseosa should be left as undisturbed as possible. We will review the role of this residual protective layer in the upcoming slides. In fact, preserving the vernix is one of the reasons why the World Health Organization, Delayed bathing for 24 hours is a recommended standard of care because it allows time for the infant to transition from the intrauterine aquatic life to the extrauterine atmospheric life and bears several benefits to the baby, including significant reduction in infection risk, promotion of parent-infant bonding through increased skin-to-skin time, increased rate of successful breastfeeding initiation, reduced risk of compromising thermal stability, impacting oxygen consumption and blood sugar levels, proper development of the skin barrier function. Several of these benefits are directly linked to preserving the vernix caseosa in the immediate post-birth period. This protective layer covers the skin of the newborn and consists mostly of water, 80%, lipids, and proteins. In utero, it protects the fetus from the amniotic fluid. A delayed first bath also means the non-interruption of skin-to-skin contact, thus supporting maternal bonding and successful breastfeeding initiation. In fact, the Baby-Friendly Hospital Initiative, BFHI, a global program launched by UNICEF and the WHO, includes this recommendation in their 10 steps to successful breastfeeding. Step 4 of the 10 steps specifically recommends delaying bathing and other routine procedures until after the initial period of skin-to-skin contact and the completion of the first breastfeeding, unless this is not possible. Immediately postpartum and continuing up to 24 to 48 hours after birth defines the transition period of a newborn. It is a complex adaptation process with major transition occurring specifically within the first 6 to 8 hours. It is during this critical period that newborns establish independent thermoregulation, with temperature stabilization between 36.4 and 37 degrees. Newborns are especially sensitive to temperature changes in their immediate environment and are at a higher risk of heat loss via 4 major mechanisms: conduction, convection, evaporation, and radiation. They in fact lose heat at a rate 4 times faster than adults. Factors that contribute to a newborn's increased propensity to heat loss include large body. A newborn's competence in regulating their temperature determines many body functions, especially that of obtaining oxygen. Cold stressors in the delivery room, in nursery environments, as well as during neonatal practices, can pose a serious challenge for the newborn to overcome during their adaptation efforts. When newborns are cold stressed, an increased metabolic. In order to eliminate cold stressors on the newborn and prevent hypothermia, the WHO established a list of procedures to perform starting immediately at postpartum and during the first hours and days of life. These procedures should be completed in the following order. 1. Setting the temperature. At the end of the major transition period, newborns should be assessed for bathing readiness. The infant should have a stable temperature, with 3 measurements above 36.5 degrees Celsius. The other vital signs, which include heart rate and respiration, should also be stable. They are easier to assess reliably if the infant is calm and quiet. An infant's normal heart rate is irregular and ranges between 120 to 160 beats per minute. Their normal respiratory rate is 30 to 60 breaths per minute. Healthcare providers should also observe for signs of respiratory distress. To perform the first bath, several methods are practiced, but the preferred approach is immersion bathing. The WHO recommends that the healthcare providers ideally wear gloves for protection from maternal pathogens during this first bath. Immersion bathing has the major advantage of reducing risk of cold sores. After the first bath, infant immersion bathing can be routinely performed at home, but does not need to be given daily. 2 to 3 times weekly is the recommended frequency. On top of the hygiene benefits, bathing improves infant sleep, especially when implemented as part of an evening routine. It is in fact a multi-sensory experience that ensures a privileged bonding. A few steps should be respected to ensure bathing is performed safely. 1. The bathtub should be placed in a secure, sturdy place. 2. Water toys should be disinfected. Once the environment is secured for safe and warm bathing, the infant should be immersed in the water, feet first. Then their face should be cleaned with a cloth dampened with water only. If there is a need for hair shampooing, the infant's head should be gently massaged with a right cleanser and rinsed carefully with water while avoid getting anything down their face. Otherwise, water is enough to clean the infant's head. The rest of the body should be washed top down. By the time the infant crawls and can sit on their own, the bathing experience changes and thus involves other safety considerations. Water depth should not exceed waist height for sitting toddlers. Toddlers should never be left alone, even though water is enough for cleaning an infant, cleansers can be added to the bathwater. It is, however, important to use appropriate cleansers to avoid harming the skin maturation. The use of emollients and oils is known to have positive effect in patients with atopic dermatitis. It is thus suggested to use appropriately formulated emollients during the post-bathing phase or at least twice per week in infants, as they may help to enhance the skin barrier. To summarise thus far, a newborn's first bath should be delayed until 6 to 24 hours after birth. At postpartum, dry wiping is recommended and should preserve the protective vernix caseosa layer. Delaying the first bath has several advantages, including a reduced risk of infection, higher success rate of breastfeeding initiation, and increased We will now engage in a brief knowledge check to